all that we can to be great because of those namesakes of our hospitals as well. But we also, remembering that history, we also want to forget about past years, the different challenges we have. We have to remember some of them, I understand that. But we want to look to the future. We want to sustain those great things that we are doing. Part of that is creating and capturing workload that will drive Eastern Kansas, Dr. Patterson talked a little bit about that, to secure increased dollars to thrive and grow. Use community appropriately. We have to look at and make buy decisions. We have 2 campuses. We have maybe one physician for one area, and if we lose a physician, or if we don't have a nurse practitioner or a physician assistant to help out with that, it's challenging. We may have to use community for that time being. But how do we build that to be able to look at it? And what makes sense to go to the community based upon a lot of these. I want to let you know that we've done some great things in capturing dollars. MCCF, Medical Care Cost Fund, CPAC, it's actually capturing dollars from insurance companies that our veterans have different insurance. We can capture those dollars. We had a goal, there was a goal of about $18.8 million. We're going to surpass $20 million, so 114%. Well, that is an increase and goes directly back to our medical center and service for our veterans. Later on, we'll get a questions to us. Thanks. Next step. So we talk about quality. Mention that as well. We're doing great within those quality metrics. We're not shooting for high on the metrics, but as we provide quality and care, those metrics will then show that we are doing it. And individuals do look at that. They do. But as we see things that, that's not as quality as we want to do it, then we put groups together to be able to sustain it and improve that. Our HRO journey, we're going down that. We're going to continue to go down that. Here are some additional things: employee engagement, all-employee survey, in your work groups, supporting you, coming up with improvement ideas, and then improvement plans, huddles, safety forums. We're going to be starting that in fiscal year 20, where we'll talk about some safety near misses or even adverse events and the learning that we gain from that. As we talk about really focusing on failure, I'll say, and knowing that that happens, preoccupation with failure, a principle of HRO journey. We know that that happens, but our goal is zero harm. And we can get there. We want to minimize that, zero harm for our veterans. Gemba boards, continuous improvement, lean training that's happening, just culture, and leader roundtable discussions. We'll be inviting groups, teams to come in and without supervisors and managers and talk with us and share your experience and what we can do to be able to help you as well. And they'll be involved with that after the fact to help you. Where do we go now? The direction. So, as you see, surgery, our GI, urology, orthopedic, eye services, where designation levels have changed. Standard complexity here in Leavenworth, and ambulatory basic in Topeka. As we looked at some of the data, that really adheres to what we were already doing, but that has been approved. We have projects in place. GI suites in Topeka, and the years there, eye care in Topeka, eye care center here in Leavenworth, surgery above ceiling. We have a project coming where it's going to be some work above the ceiling in surgery. It's pending award. That's going to impact the care that we give. So we're looking at mobile surgery unit here on site so that our staff can continue to provide care. We're also communicating with how do we do some of that over in Topeka if we can't do it all, as well as Kansas City VA, and so that we can maintain the care that we provide here in Eastern Kansas. Primary care packed. As I talked about, Dr. Barnett's been here talking with a lot of the staff, but we want to resource fully. We want to make sure that we limit the number of times our veterans are rescheduled based upon someone calling in. We want those floats there to be able to provide that. Build teams and partners and decrease those silos that I talked about earlier. That's important, that teamwork. Expand support to CBOCs. We've already done that. We know that that's what we need to continue to do. Our veterans travel. If they can, we put out in Junction City an audiology booth and a chiropractic care. That's used. They are busy. Lab. PT out there as well. Do we do that at other sites as well? To make some sense, we want to do that. Expand those CBOC and services in the coming year. Lawrence is getting a new CBOC. Wyandotte, we're gonna need to get a new one as the contract is ending, Southeast Kansas and those part-time clinics, again, Junction City, St. Joe, and then Women's Health. That is continuing to grow. It's the fastest population we have growing is our women's veterans. So we want to make sure that we're resourced and we're meeting those needs. Community care, talked about it. Staffing and resources, we're hiring a part-time physician to help us out with all the consults, those 38,000 consults that are coming. And that care coordination, the workload and workflow, again, 55% increase. It's tremendous. Getting a new community care network, and that's going to be maybe different providers that now we're seeing veterans in the community that we haven't. Hopefully many of them will be the same, but different network. They're doing some good systems, improving the systems, and talking back and forth to the VA. Care coordination is critical. When a veteran leaves for some service, I'll say dermatology, because that's what's happening right now. When they eventually come back to us, our providers should be able to know what occurred out in the community to be able to coordinate that care. We're not there yet. We're striving for it. Partnering with those providers, improving those systems, scanning documents. Within the next, hopefully 6 months, we're going to have RightFax for our, hopefully sooner, as I look back there at Catania, to be able to have that scan, not to scanning equipment, but into email, specific emails and folders so that we can track that and know what's there, and it'll be easier to get it into our system as well. And then call centers that's going on. Telehealth, as Dr. Patterson has said regarding Poplar Bluff, we have rurality. We're rural in many places across Kansas, some in Missouri. So we want to use the Vision hubs that are there, but create internal capacity within that. Working with our partners and seeing if we can, someone can go to one site while we're actually seeing them as a provider, but then maybe they have a nurse that'll help us out. Virtual health, VA Video Connect, and secure messaging. We're going to continue to push that and really work that through. Geriatrics and extended care. So whole health and pain team, CLC beds and services. We want to be able to provide that care to our older veterans who need it. We have a Geri Pact here on site. We have some projects going on and soon to be completed and seeing patients. Hospice and rehabilitation specific to Topeka, a new unit, a renovated one. 6A and B wings, renovating that and co-locating all the GE services, the CLCs there in Building 6. Again, a few years out, dining hall here needs to be moved, and so we're working on that for next year. I put 2021, that's my failure, that's 2020. So I looked at that now and saw that, oops, it's 2020. So that is, I know you two are probably looking at me like, what? He's on I did, 2020, so I apologize for that. And then home care. Our veterans are out in the community and we want to be able to keep them in the community as long as we can. And home-based primary care and other home services are amazing. Behavioral health, suicide prevention is a priority. We heard that this morning, right? We need to continue to look about how we support our veterans and those who have shared that they may be at higher risk, but just our veterans who come in every day. If we hear things or see things, build that relationship with those veterans, we can make a difference. And for those in the community as well. The card, the number of our Veterans Crisis Line, 1-800-273-8255. Should get that in your cell phones and have it there. That's the overall crisis line. Press 1 and it gets to our Veterans Crisis Line, and they provide a great support. That is going to continue a high priority for us. Fresh Start, it's been open for another number of months again, this last year, I think, earlier on, right?
Since April 8th.
April, okay.
But who's counting?
Yeah, you know. But that's been great, as I've talked to veterans when I've been up there, and then walk on this campus, and I recognize them, and they say, we met you up before I graduated from Fresh Start, and now they say they're in the domiciliary. Very important for them. And then we also have other projects, relocating outpatient clinic, the DOM, from building 122 over to the DOM. Renovate, build outpatient clinic in Topeka, a new additional space there, and building the Life Enrichment Center, a new space over there as well. So a lot of things happening. So now what, right? Well, let's go and get moving. All right, we need to develop strategies to achieve the plan and meeting those. We got to reach for those dollars within that VERA to support Eastern Kansas. Many of our clinical providers know that and Joint Commission oftentimes have said that if it's not documented, it's as if it didn't happen. There's the same thing with that financial within the VERA model. If it's not captured, it's as if it didn't happen. You could be doing tons of work. If you're not capturing it, if we're not capturing it, it's as if it didn't happen and our dollars won't be there. We have to capture that. And there's a lot of pieces to that. Another one with a high reliable organization is don't simplify everything. There's some complexity with that, right? And we've got to know that there's lots of steps to it of where you're assigned and if you're labor mapped correctly and how much and a lot of different things. Making sure that the encounters are closed, making sure that it's the correct diagnosis. All of that leads into capturing the workload and the dollars under VERA that allow that 6% increase. And it'll show also it increases ours. All that dollars come to the vision, and then we as leaders look at it and say what should come to each site. But if we are gathering more and gaining more because of the workload, more goes to the vision, and eventually more does come back to us. We have Andy Bergman, raise your hand here. He's our VERA coordinator here. Get to know him, he can share with you. But that's where we identify. We identify it, we can determine how much we have earned to that model. So, important piece. But growth, workload and productivity, outreach to increase new patients. We saw that. Market penetration is not where we want it to be. It's high, but we can get more. And there are others out there. I actually talked to someone in my neighborhood last night as they were walking along. They'd moved in probably a year ago. He's a veteran. He's not enrolled. He says TRICARE is wonderful for him. And I said, can I get you some information? And I said, we have a Platte City clinic here. And he goes, yeah, I saw that. He says, yeah, give me some information. So I'm going to get that to him. So those conversations, ways we should be doing that as well. We want to align our facility projects and space to the strategic plan. Now, we have a lot with our 2 campuses that go to facilities because of the piping that are 86 years old or older, that other things are older that we have to do, but there are dollars to be able to improve, modernize, and we're going to make sure that that's where the dollars go to. Prioritize and designate those resources to the plan. We want to execute the strategies that we come up with, and then communicate and close that loop. That's an important piece. So you understand what you have done and what it has brought to veterans, because that's why we're here. These are our pillars of success, our true north. Employee engagement, financial stewardship, and that includes stewardship as leaders too, not just financial. I believe stewardship, but we have it as financial. Quality and safety, veteran experience, and community partnerships. That's our true north. That's our pillars of success as we go forward. Dr. Patterson, anything from you else? Okay. I talked about it before I brought this picture up. I am not an expert on butterflies. Let me assure you that. I actually grew up and loved to bird watch. And probably birds get some of the butterflies, right? But I heard a story a number of years ago, and some of you may have already heard this, definitely our new employees within the past couple of years who have been through, because I do share this with our new employees. But it really, in my mind, really is a good story that really shows what VA is about. We talk about diversity and unity. Again, you look at that monarch butterfly on your left, lots of different shapes, colors. These are all different type of shapes. They say every single one is unique and different. That's millions and millions. You can imagine if one of those changes, but if each one changes a little bit, they're unique. And I believe that's us. We talk about diversity, diversity in race, diversity in culture, diversity where you were raised, how you were raised, where you went to education. Do you have kids or no kids? Are you a veteran or not a veteran? All of that brings different ideas, innovations to the table and to your team. That makes wonderful things in going forward. Now they use the sun to position and find the direction where they need to go. They actually travel from Canada to Mexico and back every year. And that's a lot, right? They know that's their purpose. Yes, they pollinate along the way, right? But that's their purpose, and they achieve that going forward. Someone who was a little more expert than I, and I'm going to use that, she said I could, is that they can make that distance with 30% of their wings. I didn't know that. Learned something. One other thing, you know where do they come from? Cocoons, right? They have to get out of that, and sometimes if you remember that, it takes them a struggle to get out. Sometimes those struggles make us really strong to meet the mission that we have, which are serving veterans. On your right here, it's multiple monarch butterflies together. That's called a kaleidoscope. I'm going to age myself here. I remember as a young boy in Orem, Utah, growing up, Christmas time, getting that device. I see some heads shaking and knowing what I'm talking about. Others don't, you guys are too young. You can probably see it all on your phone now, right? All those pretty things. But turning that and just being amazed at that. Kaleidoscope, when you think about that, they're unified. And they do that to be able to protect against predators